It is our final segment this morning, talking about chronic pain and hypnosis and maybe some of the other things that can help folks with. Dr. Lindseday Mckernan is with us. She is from Vanderbilt, a doctor. Steve Olson is one of her patients who is dealing with chronic pain now with his mind.
Yes.
You never dreamed it.
No.
You never
ever thought this could happen.
And it's worked. All right, let's take a phone call here. It's our final segment. We'll go to Andrew. Hi, Andrew.
Hi, I have a question about getting referred to the Osher Center. I have a rheumatologist at Vanderbilt, but not part of the group. So can that referral come from him, or does it have to come from someone already within the Osher Center?
So the rheumatologist would need to refer you to get a medical consult at the Osher Center. So that would set you up with a first appointment where you can have sort of an integrative medicine consult, and hypnosis would be one of the treatments available.
And by getting the referral that he asks for, does that help you set that? That means that you've got that referral. It's medically something that insurance would cover? Is that part of the process?
Yeah.
Doing that?
Yes, you would know that at that point.
But do you need a referral to do it, or can I just show up?
It depends on your insurance. Some insurances require you when you see any sort of tertiary clinic.
You go to your primary, and then he sends you.
So, Andrew, the number is 343-1554. And that will
343-1554. 615, of course. That's what you call to do what? To get the...
To get set up for a medical appointment. At that time, you can let them know, Andrew, that you'd like hypnosis, so we can go ahead and get you on the waiting list so you don't have to wait any longer.
Let's talk then just about the conditions. We've touched bases on his pain and that. What are the things, again, and you've hit on some of it already, that show you guys deal with there? What kind of patients can you see? What are they coming to you for? Is it mostly pain?
So a lot of times it's chronic medical conditions.
Okay.
And I use that plurally because quite often there are conditions layered upon conditions.
All right.
It doesn't have to be that way, but we often see people with multiple diagnoses. Sometimes they're unexplained pain. And it can come from different sources. It could be pain after an accident or a surgery. It could be pain that just came out of the blue, or that's been around for a long time. And the medical consult can kind of give a complementary perspective on the other things that you can be doing that can help with pain. Okay, so and as you said, pain, but smoking cessation? I've heard of that for a long time. I don't know if you deal with that. You know, I don't do it at the Osher Center for Smoking Cessation, but you can do hypnosis for smoking cessation and for anxiety and phobias, for example.
Think about that. So is this growing the field? I know more people are trying it, but what frontier is there with hypnosis? What comes next? Where is this field going?
I think right now they're working very hard to understand the mechanisms by which hypnosis work in the brain. They've done some work on that already, but there's a lot more to be done. They're starting to integrate it with virtual reality for very painful procedures, you know, where people put on the goggles.
Right, so how you be hypnotized?
Yeah, you do hypnosis, and then you follow a visual imagery in virtual reality, and people do that while getting burn wound changes, for example.
Which is super painful,
very painful stuff.
So, as opposed to doing that without having to give them as much morphine?
As much, and some people can't take morphine because of their heart. You know, I know of one sort of anecdotal example. One of my mentors worked with a patient who had a heart attack due to too much morphine, so he had to keep having these burn wound changes but couldn't have pain medicine anymore, so he just did it with hypnosis.
I was wondering about that. That has to be, because I know as you described, your pain was excruciating in your legs. I can only imagine getting hit with a bat in the thighs, right? What's the most I mean, when we talked about people going to the dentist maybe and getting a root canal, you have a doctor friend of yours that does that, right? Or, holy cow. And then burn treatments. How high a level of pain management can you get to with, you know, could you undergo surgery?
You know, I don't know. I know that they do it before surgery. You don't have to use as much anesthesia. The analgesic response you get from hypnosis is generally about 30%, which is about the same as what you get from an opioid.
Is it 30%? Is that right?
On average. Yeah, at most. Yeah.
All right, and a lot of surgeries are literally knocked out, which is a different ballgame.
Yeah, that's a different ballgame. But you might not have to have as much anesthesia, which is great when you're getting older too, because the more anesthesia you have as you age, it increases the risk of a lot of other things.
Oh man, every time someone senior who's already beginning to slip goes underneath general anesthesia, they're never the same again, or it takes them months to get their lucidity back. I've noticed that. All right, so what would you say, Steve, to people that are watching just out there and they've heard your story and they think, you don't have a dog in this fight other than you're sharing your personal story. You're not an investor in hypnosis or something like that.
No,
You are
I would say don't give up. If a doctor tells you they can't do anything else, that's just in their specific field. That doesn't mean there's something else out there that can't help you.
Yeah, that's just their field. And it can be anything from what you suffer from to back pain to whatever. Just don't give up on that. And if someone's taking opioids right now, and it's working, but they don't like taking all these pills and getting the side effects that come with it, I guess.
I would say to get in touch with your doctor and have them see if they could send you to OSHA or some other place that maybe does hypnosis that could possibly help you and get you off of, maybe not completely off of the opiates, but maybe wean you down off of such a large amount that you may be taking.
Yeah, I mean, Dr. Mckernan, do you think most other doctors, the general practitioners out there, they can be slow to come around sometimes to new treatments? Now, I don't know how new you'd say this is, but will they be aware of this, or do you think someone will poo-poo it?
I think a lot of people just don't know. Yeah. They don't know that it's still being done, and also maybe some of the literature behind it. So I work very hard on campus to do talks about this and to get the word out. We're not short on referrals. People would think that this is something you'd be hesitant to approach, but we get calls all the time about this. And then once a doctor refers a patient who then has an experience similar to Steve, or like the dentist with the TMJ case I was telling you about, then we get lots and lots more referrals. So a lot of times it's often through patient experiences that seems to make a difference.
Word spreads. Yeah. Well, and my take kind of on this is, as I look at it, unless you just have some phobia of hypnosis for some reason, I don't know what the downside is. This isn't like some experimental new drug that could have a horrible side effect, or this isn't some surgical procedure where they're cutting you open where it may not work. I mean, worst case scenario, you can't be hypnotized, and you know what? Sorry, this isn't working for you. But it's not like it's going to poison you, or it's not going to leave you with a scar that was for nothing, right? I mean, is there really a downside that where it doesn't, worse aside from it not working?
No, it may be time. It does take a little
you spent some time. You might say, gosh, spent all that time and it didn't work. But I mean, aside from that, though, it's not something that's really going to hurt you.
No, and sometimes, like when we were sort of working on this together to see what felt good, you had the experience of heaviness in your body one day. And that didn't feel good on your legs because your legs felt so heavy that you didn't feel like you could move them. And so we have to kind of learn from those experiences and then shift our approach. So I would say that would be one thing, is just to be very collaborative with whoever you're working with if something doesn't feel good to your body, as a particular perceptual change. So
that was early on when you guys were working together and you were opening the door, maybe where you were getting rid of some of the pain, but in place of it, your legs just felt very heavy, or how, while you're learning what works?
Right. I was just learning what works, different ways I can approach the pain and deal with.
So you're approaching it, and what you did maybe took it, but instead your legs just felt real heavy.
Yes.
And so then you tried something else.
I had my hands on my thighs, and
that's what it was.
I couldn't move my hands because I was under the hypnosis.
Because it felt so heavy.
And they started feeling heavier and heavier and heavier, almost like somebody was sitting on my legs.
Now, is he able, while he's doing that, to give you feedback, even though he's in that stage where he's not fully asleep, and he's hearing you making suggestions, and then he can say, my hands are too heavy, or do you know that, or is that something you find out afterwards when you come more awake?
It can happen both ways. You can talk and converse during hypnosis, and sometimes it just is after the fact, because you might be so relaxed at that point that you're experiencing it but not saying. So when you're one-on-one, you check in constantly. In the group, you just have to work with the provider afterwards if something like that happens to make adjustments, is usually how we do it, because we've got 14, 15 people in the room.
Right.
And we do a little questionnaire type thing both before the class and after, and also have group discussions on how we felt from going through it.
Right. And you've been doing it now, you said, for 2 years?
Yes.
And your plan is this is your treatment for the rest of your life?
I have finished with both the groups, and I don't know if there's a future group or anything she's going to continue with at this point. But it's just made such a change in the fact that I can go do this by myself, and just if I don't practice it, it's not going to help me.
You think you could teach other people?
No.
No. It's interesting. So it's different because you know what works for you, but you're not a doctor who can know to set something up. But you can tell people how it worked for you. And so again, you're going to do this the rest of your life.
Yes.
Really? Do you think you might get to the point where you could ever go back to work?
I would love to go back.
I know you would. Most people, everyone's like SSI or whatever, disability, you would love to go back. If you got to that point, I mean, you sure seem like, and I don't know how it is day in, you may get tired.
I couldn't even go up 2 stairs on a ladder or steps on a
But
stairway.
now you can?
I could, yes.
Holy cow. So you put people back. How awesome is that?
Yeah. It's really rewarding.
It must be. And are there other doctors like you at Van? I mean, are you the only one doing the hypnosis?
There are trainees that work with me.
Just trainees
as well.
right now. Students that are learning, or is it?
Students, so doctoral level students and postdoctoral level students. So they're psychologists in training.
It's a psychology major with a minor in hypnosis?
Not even that. It's just a technique you learn as a part of your training, like I would while I was in graduate school. Learn all these different things to do.
But hypnosis would be a course that was taught by someone, or no?
For me, it was, yes.
But there can't be a lot of those out
there. No,
there
really aren't. I got lucky.
And yours was at UT?
It was at UT Knoxville with Dr. Michael Nash, who is a godfather of hypnosis.
Oh,
and I had training with him, and then I stayed doing that for 3 years in graduate school, and then I kept going through my work at the VA and then back at the Osher Center. It was just a real natural fit.
Is he still there?
He is Professor Emeritus now.
Along with Dr. Bass.
But he does hypnosis in private practice, and there are a lot of people that do hypnosis in Knoxville because they've trained with him.
Fascinating. That's what. Lindsay, Dr. Mckernan, thank you for coming on.
Thank you for having me.
It's a pleasure. And we didn't violate any HIPAA laws here, Steve.
Nope.
Thank you for coming on and being so open and forthcoming with us. And I'm so happy for you. That is fantastic. It's great to meet someone like you who's doing so well. And like you said, it's gratifying, isn't it? Thank you both. We'll take a break. I'll have a programming note as well as giving out that phone number again for folks about how to call to get information about getting involved in one of these programs. We'll be right back after this. Stay with us. Thanks, you guys.
Sure.